Hi, everyone. I'm Dr. Lisa Palmer, and I have a furry guest that decided to jump into the video. He wanted to say hi to you guys. Tonight's topic is on summer stress and solutions to natural health care problems. Summer stress and solutions to natural health care problems. I'm Dr. Lisa Palmer, Dr. Mama Bear. And there are a lot of people that are stressed out. I would say it's probably one of our major complaints that our patients come to us. They are stressed out with their life, they are stressed out with things that are happening, they are having trouble with, I don't know, handling their household, handling their kids, handling their work. They are just overwhelmed, I guess is a good answer. They are overwhelmed with what's happening in their life. And so when you have problems and you don't have solutions to problems, it causes stress. Now, it's the summertime, which is awesome. It's awesome in that a lot of families are traveling. One of my friends, she got an RV and drove from like Florida all the way to California. Like that is a road trip. There are people that are struggling. They're stressed because of their health. They're stressed because their dog's butt is in the shot. They're stressed in the summertime because of the heat. So I got in the car earlier today. It was 100 degrees. And then thank goodness it rained and it cooled it down about 20 degrees, which was great. But then, of course, it was lightning. So then you don't really want to open an umbrella with the lightning. But then we were getting wet. So the stress of summer and in Florida, summer means that it's going to rain at some point, which is absolutely okay with me because it's good for my avocado tree. It's good for my grass. It's good. It's the best to decrease the temperature from in the hundreds down to the 80s, and I'll take that. It's kind of crazy for my hair. It makes it really curly. But yeah, so stress and summer. And then of course parents go a little crazy towards the end of the summer when school starts. Moms get really stressed out. I think one of the most stressful times I see with moms, other than the pandemic, is the start of school. So preparing, the backpacks and the school supplies and changing the schedule and getting everybody out of the house on time could be a lot on a family. The kids, the students, a new grade level, new teachers, new books, new everything could be stressful. We homeschool and unschool, and so we go to school year round. Shh, don't tell my daughter. And I love it because I get to teach her what she wants to learn. She's learned weird topics or great topics, everything from doing payroll in a successful company to putting in retirement plans to working with inventory, working with stocking, help develop marketing. I mean, it's really cool to see what she's learned at 10 years old from homeschool, from unschool. And then sometimes I have that mom moment where I'm like, okay, is she learning enough, right? Is she learning enough? Am I doing a good enough job? I do have help. Mia helps me, which is awesome. Jason helps me, which is awesome. But I sometimes wonder, are we doing enough? And then we'll get a new employee and the new employee will ask a question to the office manager. And before the office manager can answer, my daughter's saying, blah, blah, blah. This is the answer. I'm like, oh my gosh, you know that. Like, how do you know that? Right. And so I would encourage you, if you are feeling stressed, look for what is the problem and then what are potential solutions to the problem, and then pick the answer that is the best for your family and the best for your community and the best for your job and the best for what's going on in your life. And usually you'll pick you'll have a solution. It's where people stress out, where they're like, I don't know, they stay in a maybe. Should I do this thing or should I do that thing? Or should I go here? Should I go there? Should I stay in this job? Should I quit this job? It's the maybe choice that is causing the problem. So make the decision and you will be less in the problem and you will have less stress. Other stress, a big stress we see also is body conditions that the person does not have solutions for, right? So maybe they have migraines. Maybe they have really bad period cycles. Maybe they have eczema. Maybe they have, I don't know, you guys can in the chat, right? Things that could be occurring. Maybe they have problems sleeping. Maybe they have I'm working with a patient this week that's had multiple concussions, and so they're having problems thinking. Once you have a concussion, you might have trouble thinking of words, you might have trouble communicating what you want to say, you might be misemotional, you might get angry fast. I remember after one concussion, I went to the cafeteria. I was in college. I was trying to order corn or carrots. I don't even remember. That's how bad it was concussed. I was trying to order a vegetable and I asked for carrots. And the lady's like, "Where's the carrots?" And I pointed and she's like, "That's corn." And she looked at me like I was the dumbest person ever. And I'm a very good student. I'm intelligent. I'm not stupid. But that definitely had a negative effect with the concussion that I suffered playing soccer. And so what is the problem? What are they stressing about? What is something they can't fix? Maybe it's their baby's eczema. Maybe it's the teething pain. Maybe it's a bloating stomach. Maybe it's gassy. Maybe it's digestion. Maybe you bloat so much that people think you're pregnant. I went through that. People thought I was pregnant and I was just really bloated and it was because I had parasites and I had to take stuff like this. So Isbor from Cellcore, really, really good. Isbor from Cellcore. And I've been taking droppers, but maybe you have a problem. Well, absolutely, if it's in the health realm, absolutely, you have a problem. No one's given you a solution for the problem because maybe your lab tests were normal. Maybe your imaging was fine. Maybe your analysis was fine. They didn't have an answer for you, so they put you on a steroid, they gave you an antibiotic, but you still have the problem. That will cause stress. That will cause stress. And if it's the summer, that's summer stress. And what we do here at Palmer Natural Health is we look for the solution. So if you have this problem, we want to find what the cause is of the problem. And then instead of covering up the problem, painting the problem, putting duct tape on the problem, we want to help rebalance your body, figure out what is the exact way of handling that, give you some information that you can apply. Maybe the problem is chemical exposure. Maybe you were exposed to pesticides. I had a patient who she was 16 years old. All of a sudden she developed seizures. What a nightmare for her mom. What a nightmare for her family. What a nightmare for her. Whereas all of a sudden she's fine. She's turning 16. She starts getting seizures. No one could figure out why. The neurologist didn't know why. The doctors didn't know why. She ends up in my office. And we do the very specific testing on her and find out that she had some kind of exposure to pesticides. And I said, what's different? And she goes, well, the mom said, well, we were in this house and then we moved to this new house, which we're in now, when she was 16. And the cool thing about the house is there's external portals, external connection valves where the pesticide companies don't have to come in and spray. They just connect externally from the house. They don't come in the house. And in the walls of the house are pipes. And in these pipes, they spray this pesticide. They spray this gas. And it's cool because the pesticide just stays in the walls and everything's cool. We kill the bugs. Well, do you guys think that the pesticides are contained by drywall? I mean, have you ever seen how flimsy drywall is? It's kind of crazy. We make walls with drywall, right? And so it can escape out the outlets or whatever. And so a bug spray can shut down the nervous system of a bug. What does a bug spray do to a human, right? Not good things. And so we were able to detoxify her from the pesticide exposure that she had and then decrease her seizures. Now, I'll tell you, I didn't completely get rid of her seizures, and here's why. Is the mom, for some reason, probably because she had pesticides in her system too, but the mom didn't completely let me finish with the daughter, and then she didn't completely understand that the pesticides were negatively affecting her daughter, and so she let that pesticide company continue. So I was starting to detox the daughter with very specific products, very guided, professionally guided. The daughter had less and less seizures. The daughter knew she was having less seizures, which was awesome. My goal was to help her that her body didn't do seizures anymore. And then all of a sudden the seizures got bad again. And I said, hey, did that pesticide company come? And the mom was like, I don't know. They come from the outside. And she checked and they absolutely came. And I go, please cancel that. I go, the ants are not going to kill your daughter. The spiders, most likely, brown recluse could cause some damage, but most likely not going to kill your daughter. The cockroaches aren't going to kill your daughter. And like if you live in Florida, it doesn't mean you have cockroaches and ants and all that stuff all over the place, especially if you put food away and you don't leave plates of food in bedrooms and stuff like that. I go, but absolutely, the pesticides, the nasty chemicals in that spray are negatively affecting your daughter's health. And so please, please cancel. I didn't even say consider. I'm like, please cancel that pesticide company. And she didn't. And in fact, she said she wouldn't. And then she stopped bringing the girl in, right? So what we look for, and that was stressful for me because I want my patients to do 100% better. And she was improving, but she wouldn't let me continue with the case. And so if you're stressed, if you are stressed because of health reasons and you want natural solutions for the cause of your problems, please reach out to me, Dr. Lisa Palmer, Dr. Mama Bear. My office is Palmer Natural Health. We can do in-person appointments. We can do telehealth appointments. But more importantly, you'll have someone listening to you, grabbing the information on what is happening with you, putting together a personalized program for you, and helping you improve with natural solutions. Good night, everyone.